Vitamin D is a fat-soluble vitamin, synthesized by our body following exposure of the skin to UVB sun rays, and to a lesser extent through some foods we eat, such as fatty fish, salmon, mackerel and herring, egg yolk, cod liver oil, and other animal foods such as pork, beef liver, and butter. Vitamin D is also known as the sun vitamin and performs numerous functions including promoting the absorption of calcium and phosphorus in the intestine, maintaining the health of the skeletal system, and stimulating the immune system, as well as having anti-inflammatory and antioxidant properties. Vitamin D deficiency is a global public health problem, and according to Harvard University, there are approximately 1 billion people with a vitamin D deficiency worldwide, while 50% of the population has insufficient levels. During autumn, but especially in winter, shorter days and often bad weather decrease the chances of sun exposure and therefore our vitamin D levels. However, when this vitamin is present in insufficient quantities, your body could send you some signals. Vitamin D deficiency can often be difficult to notice because symptoms may not show up for a long time, and when they do, it means your levels are very low. Let's see what some symptoms of hypovitaminosis D could be. Frequent illnesses or infections. Vitamin D plays a fundamental role in activating our immune defenses, thus defending our body against infections and infectious diseases caused by foreign pathogens such as viruses, bacteria, and fungi. If you get sick often, especially with colds and flu, you may have low vitamin D levels, which are responsible for increased susceptibility to infections. It is no coincidence that seasonal flu generally reaches its peak in winter. That is when there is less exposure to sunlight and therefore a decrease in the production of vitamin D. According to some studies, low levels of vitamin D are associated with an increased risk of respiratory tract infections and respiratory diseases, leading causes of death in developing countries and responsible for more than 4 million deaths worldwide annually. Tiredness. The feeling of tiredness and muscle weakness can be due to a number of causes, and one of them is a lack of vitamin D. This could be due to a reduced deficiency of the mitochondria, tiny organelles present in large quantities inside the cells, responsible for the production of the necessary energy that the cell needs to grow and reproduce. Mitochondria are a kind of cell battery, which if they don't work properly affects the whole body, making us feel tired and fatigued. Thanks to some studies, it has been discovered that following the administration of a vitamin D supplement, mitochondrial functions have improved and symptoms of tiredness have been reduced. Loss of bone mass. We have said that vitamin D plays a crucial role in the absorption of calcium and phosphorus in the intestine and ensures normal bone mineralization. Given its role in maintaining bone health, among the consequences of hypovitaminosis, we find pathologies related to bone metabolism, such as rickets, osteomalacia, and osteoporosis. Among the symptoms you may experience, we find pain in the bones, joints, and muscles. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This leads initially to osteopenia, and may subsequently progress to osteoporosis, a systemic disease of the skeletal system characterized by a reduction in bone mass and a deterioration of the microarchitecture of the bone tissue, which induces increased bone fragility, with a consequent increase in the risk of fracture due to even minimal trauma. Hair loss. Hair loss is a physiological phenomenon of hair replacement and is part of its natural life cycle. On average, we all lose 50 to 100 hairs a day, and during the spring and autumn season, the number tends to increase. However, when hair loss becomes excessive, it can be a sign of something wrong with your body. We know that vitamin D has the task of stimulating the hair follicles, a shaft or opening on the surface of the skin through which hair grows. However, when levels are low, hair growth is negatively affected, and they are more at risk of falling. According to some studies, vitamin D deficiency is associated with alopecia areata, an autoimmune disease in which the body's immune system recognizes the hair bulbs as foreign and attacks them. Among other consequences, we find androgenetic alopecia, the most common type of hair loss, also known as baldness. Insomnia. Sleep represents a third of our lives and is essential for our psychophysical well-being, as it allows us to recover the physical and mental energy spent during the day. In fact, the guidelines advise adults to sleep between 7 and 9 hours a night. Some studies have shown that vitamin D is also linked to the quality of sleep, as it intervenes in the regulation of the circadian rhythm, a sort of complex internal clock in the body, based on a period of about 24 hours, which ensures all the physiological functions related to life, including regulating hormone levels, sleep, and metabolism. The circadian rhythm remains synchronized with the natural cycle of day and night and is influenced by the levels of vitamin D present in the body, whose receptors are in fact scattered in the areas of the brain that regulate the sleep-wake cycle. Several observational studies have shown a possible association between vitamin D deficiency and worsening sleep quality. This increases the risk of the onset of some sleep disorders, including insomnia, a disorder characterized by difficulty falling asleep or by frequent awakenings during the night, which prevent those who suffer from a pleasant and regenerating sleep. Depression. According to a study conducted in the Netherlands, people with a vitamin D deficiency have a significantly higher risk of suffering from depression than people with normal levels. The World Health Organization defines depression as a disorder characterized by persistent sadness and loss of interest in usually pleasurable activities, accompanied by the inability to carry out daily activities for at least 2 weeks. The exact biological mechanisms linking hypovitaminosis D and depression are not yet fully understood. However, we know that vitamin D modulates the hypothalamic pituitary adrenal axis, central coordinator of the neuroendocrine response systems to stress, which has the task of regulating the production of the neurotransmitters epinephrine, norepinephrine, and dopamine in the adrenal cortex, and also protects against depletion of dopamine and serotonin. Among the symptoms related to a vitamin D deficiency, we therefore find mood alterations, accompanied by feelings of sadness and despair, and a greater likelihood of experiencing anxiety disorders and panic attacks. If you experience any of these symptoms, do not ignore them and contact your doctor. The vitamin D deficiency is easily measurable through a simple blood test and is treated thanks to the intake of specific vitamin D supplements, where the exact dosage and duration of intake must always be evaluated by your doctor.